Good afternoon, good evening. A very, very warm greeting from Copenhagen, from the regional office for Europe in WHO, to you colleagues in Athens and elsewhere in Europe. I regret not to be able to join you live due to other commitments, but rest assured, please, that like you in Athens, the whole of Europe is celebrating the World Mental Health Day, because we are living at an unprecedented time of awareness and acknowledgement of the importance of mental health, not only in the public health in general, but also in the cohesion of societies. As we have seen from COVID-19, the mental health services and systems were unable to cope with increased demand for those services, also to unsuspecting vulnerable groups such as, for instance, the healthcare workers. We saw that due to decades of under-prioritization, underfunding, and under-resourcing of mental health services and systems, our systems were not able to cope with not only an increased demand, but also with a community that is evolving every day. What we're seeing is that a series, a consecution of crises that in WHO Europe we are calling a Perma Crisis, such as, for instance, starting with COVID-19, but also the number of armed conflicts that we are having in our region in WHO Europe. And I mind the plural here, because we are having more than one conflict occurring now. But also a crisis such as, for instance, natural disasters, provoked emergencies, and Greece hasn't been spared by such disasters. The cost of living, a steep increase, are causing not only a very relevant impact on the mental health of our populations, but also are eroding the trust in the institutions that is so important for cohesive societies. So as such, if we want to be able not only to play our role as mental health workers into addressing mental health of individuals, but if we also want to contribute to the well-being of cohesive societies, we need to rethink our mental health systems and services. WHO, together with the global mental health community, has called for decades for community-based mental health services that can be built hand in hand with deinstitutionalization processes towards services that are fit for purpose and that are oriented towards recovery. But what do we mean by community? Until very recently, communities were understood as physical spaces where people meet and people live their life and people interact and exchange with each other. So communities were primarily seen as physical spaces. But let me remind us all how the community is becoming increasingly digital. Agoras, as they were seen from ancient Greece, are now moving someplace else, and those are the digital spaces. Mainly our young people are increasingly moving their interconnectedness into digital spaces through digital tools, social media, artificial intelligence, if you like, etc., etc. And therefore, we need not only to be aware and acknowledge this change, but we also need to design our responses accordingly. We can no longer talk about community-based mental health services without taking into account how communities are changed, how communities are no longer physical spaces that have been seen as for social interaction purposes only, but communities are also where people live their lives in education. Schools and academic institutions are also communities. Workplaces are communities. Digital spaces, as are mentioned, are communities, and so on. And this is a very good guidance about how mental health systems and services should be built in the very near future, that we need to take into account how communities are evolving so that our systems and services are tailored and not the other way around. The second consideration is who are the systems and services for? It has traditionally been the prerogative of the health providers to decide how systems and services are. And this is not only in mental health, but there has been an increasing empowerment of the user communities, of the communities that use the health services. So an increased empowerment for having more voice from those communities, not only to evaluate and to assess how those services are delivered to them, but also how those services are planned, are designed, and therefore are then organized and delivered. So the voice of mental health service users has become a very important part in the stakeholder table. All those who sit around the table should necessarily include persons with lived experience in a non-tokenistic way. We have seen often how mental health service users sit around the table so that we, the health providers, can tick a box and say that our services were designed and planned with participation by mental health service users. But this is no longer the case. People with lived experience are expecting real participation, and this is what I think this is what has inspired the theme of the World Mental Health Day of this year, that mental health is a human right, because it is the right of the persons who receive the services to be able to have a say on how those services are planned, are designed, are regulated, are monitored, are evaluated. And then the cycle continues. So participation of people with lived experience is the second point that we in WHO Europe would like to highlight as a very important message for this year's Mental Health Day. A third point is, how do we invest into the services? There is always lamentation, collective lamentation by mental health service providers and policymakers that the budgets to mental health are low, and this is true. There is no country that invests sufficiently into the mental health services. But what is another truth is that not only that we have low budget, but those budgets can be distributed better. We should not only invest more, but we should invest better. And there are two moments that I would like to make here. One moment is that the promotion and prevention aspects of mental health systems and services budgets, they are very often seen as an afterthought. So you very often have initiatives in promotion campaigns, for instance, that are seen as separate initiatives from the whole continuum of mental health systems and services. And this is not serving the greater purpose of having an integral, comprehensive network of mental health systems and services. So the investing in promotion and prevention should not be an afterthought. It should not be in parallel, but should be an integral part of the planning and regulating of mental health systems and services. The second point is financing. We are not able today to measure how countries are financing their mental health systems for one simple reason, because mental health services are scattered and fragmented. Some of them sit under primary health care, some others sit under the hospital care of the same Ministry of Health, and some other services in the same country sit under the Ministry of Labor and Social Affairs. So it is very often difficult for a country to trace how they are paying for mental health services. This fragmentation should come to an end. And not only the fragmentation, but also the way how we budget for services. In most countries, the budget is historical, meaning take the budget from last year, add an inflation adjustment, and then there you have the budget for next year. This has to come to an end, because this approach does not account for evolving needs, for new emerging needs, and for evolving communities. So if we are able to rethink our mental health systems and services as per evolving communities, if we are able to truly, authentically include the voice of the persons with lived experience and their carers, and last but not least, if we are able to invest more, and as importantly, invest better, we will be able to see a change in how our mental health systems and services are planned, are designed, are delivered, are monitored, are evaluated, and then improved. And with this, a big thanks to Professor Christodoulou again, a big bow of respect to the esteemed colleagues in this panel, and looking forward to continue working with you for better mental health systems and services in Europe. Have a great evening all. Thank you.